If you walk away and your work get head and I make you feel alright, go feel the night. Welcome to the Good Work Podcast. My name is Tony Morris Agbo, and today we have a very special guest on this episode. And he's the first person on this show. And this is our first episode. He's a friend, he's a brother, and he's also a doctor in emergency medicine here in Ireland. His dedication to saving life and making a difference in healthcare is truly inspiring. Please show him some love wherever you see him. Welcome, Dr. Chike. How are you keeping today, brother?
Thank you very much.
You're welcome.
Yeah, thanks for having me here as your first guest. It is a good concept, and I like this platform, to also share some ideas to your audience and also with yourself as well. So it's great. Thank you for having me.
You're most welcome. We created this platform for individuals like you who are making a real difference in our society and the world. So we are very lucky and happy to have you on our show, brother.
Thank you.
You're welcome. How was your Christmas celebration?
It was fantastic. Christmas is usually family time. You have relations and friends as well to celebrate with. So it was a fantastic experience. And at some point, you just focused on the moment of Christmas and then focused on family and also get some rest, much needed rest as well. So I didn't need to think about work or anything, which is great.
We needed break, man. We needed break.
Yes. But it was wonderful. It was wonderful and magical.
No,
very
good.
merry.
That's good to hear. That's good to know.
Thank you.
Good, I would like to ask you a little bit about your origin.
Oh, well.
I know Ireland is your second home.
Yeah.
But I know you and me, came from different part of the world.
Yeah. Very far away. So originally I would have come from a town called Akko. Waited to local government, Soccer of Enugu State.
Okay.
Yes, I was born in Enugu, raised in Enugu, but my interior identity is Akko. Yeah.
Wow. Sounds like a beautiful place.
Yeah, it's a phenomenal town with a lot of diverse inclusions. Akko is very popular in the sense that in the whole of Enugu State, we will have the highest number of professors.
Okay.
And also a lot of doctors from my town. In fact, I think we've generated the highest number of doctors in Enugu State. I don't have the statistics with me, but I can tell you that is very close to that, most likely.
Oh, most of the professional people came from there.
we brag with our
I wish that I come from there as well.
Yeah, because we are really into our studies, and our professional background is what makes us.
Yeah,
because it's a small town where you have very smart people.
Yeah, of course. That's my number one accolade for you. My number one respect, like you're a very, very smart guy. Not only a smart guy, you're a great guy.
Thank you.
A great man. Yeah, I know you for that, and I'm truly happy to be your friend.
Yeah, thank you.
You're welcome, brother.
Likewise.
So I will move on now to ask you a little bit about your professional background. So if you don't mind, would you tell us a little bit about how you got into emergency medicine? And what was your training and education journey like? What made you decide to pursue a career in emergency medicine?
Well, I mean, it's not been an easy one. It's been a roller coaster of a journey because, firstly, even to think about being a doctor was an inspiration from my dad. He was a surgeon himself. Yeah. So I, from a very early age, has been exposed to him practicing. And I've seen different things that kind of inspired me to really want to be there as a doctor, and if possible, a surgeon. And so I started my studies in Enugu and went to Ebonyi State University, where I started doing medicine.
Oh.
Now, you know the Nigerian academic system. It's very good.
They are like off and on.
That's the problem. There's always one thing or the other. If it's not the ASU strike, it's the cultism in there, or the corruption, the strike by students because of increased fees and, poor atmosphere for studying and so on. There's just a lot of things going on. And that's why when you eventually graduate from a Nigerian university, you've actually been through different systems. So you've actually gone through the university, and the university has actually gone through you as well. The time, the delay, the things you lose because of those delays, to avert all those, I, had to think twice about continuing my studying there. And my dad was like, as well, very supportive. And he said, listen, you need to go to Ireland. And as God will have it, I came to Ireland. And not just that I studied in Ireland, but I studied in the best university in Ireland, Trinity College.
Okay.
Now, while I was there in Trinity, it's another challenging experience because you've come into a class of over 124 students, and you are the only one from Nigeria in the, the only black man in the class. It wasn't an easy one to navigate through, but they were the nicest people that you can ever ask for classmates. So it easily assimilated me in there, and studying was kind of easier through that channel. Now, finished school, came out, again worked in the best hospital in Ireland, which is St. James's Hospital in Dublin. I did my internship. It was a fantastic experience as well. Came into Galway to start my surgical training. And one of my rotations in this was emergency medicine. So I did 6 months of emergency medicine in Galway. And then I did general surgery, orthopedic surgery, urology, cardiothoracic surgery. So it's a mix. And I felt that probably continuing my exploration into surgery may not be the best thing for me because I don't know, I wasn't overly fascinated about surgery in general, but I felt that the one way I could apply all the knowledge that I have gained from all these different specialties was actually to do emergency medicine, because my knowledge in urology can be applied there. My knowledge in orthopedics can be applied there. Knowledge in cardiothoracic surgery can be applied there. And even in general surgery. So putting all this together, I got a better inspiration to do emergency medicine. Went in there. I've done it for the last 13 years. I've just been in emergency medicine, and I've really enjoyed every bit of it.
I love it.
Yeah, it's fascinating. What happens, what you see in the emergency department, the different cases that come there, and how they've been managed. It's so fascinating. I really love it, and I think if I should do this all over again, I'll do emergency medicine again.
Wow, that's good.
No regrets.
Yeah, that means you're living the dream.
Well, I mean, I wouldn't say I'm living the dream, but
you're happy
at least exactly.
So
and it's more or less a dream job.
Yeah. Okay. Cool. Yeah. As far as you're happy at your job, that's what it's all about. Okay. It's not good to work in an environment that you're not happy.
Exactly.
Wow. I can imagine. Like I am nothing to all that. no professional background, no educational background. Yeah, I sometimes imagine how a professional guy like you want to hang out with ordinary guy like me.
Well, in this life, nobody is ordinary. Everyone have got their own uniqueness and special qualities. And that is why to be a balanced individual, you require everybody. You require to be surrounded by people that have the things you don't have, and people that also need the things that you have that they don't have also need to be around you, and that's what life is all about. In our local dialect, we say "akani kwake bake bakwakan." Permit me to.
That means if
use
left,
that.
wash the right, right hand will
wash the left. So you need everyone.
Take us, far away.
Exactly. Nobody's an island.
We're an island now. Island. Yeah. All right. Beautiful. Wow. It's a quite interesting one. So in between that question now, I would like you to tell us, where was your first workplace? I know you mentioned something James Hospital.
Yeah, St. James's Hospital in Dublin.
Yes. It was in Dublin.
And that happens to be the busiest and the biggest hospital in Ireland.
Wow.
It's a complete hospital, if you put it that way, center of excellence in a lot of specialties for the whole country. I had a very good exposure there, and I acquired a lot of experience there. I'm very happy and privileged to have worked there. And eventually I will still do some more jobs in James's at some stage, but at the moment I'm just happy where I am.
That's good. Yeah, I know if we can duplicate you, you can be everywhere, at the same time. That's good. Moving forward, in between those time of your study, have you done any other job, not related to your career job?
Well, during my study times, I worked still in the hospital, not as a doctor, but as a care assistant, because, you always have to have a job or two to also sustain yourself. So I did do one or two of those jobs, but
that is in hospital.
In the hospital,
okay. Which is good.
Sometimes they sent us to nursing homes to do some care jobs there. So I did that. Yes, and again I enjoyed it because I am also looking after patients. And the whole aim of my studying is to take care of patients. So that was a stepping stone for me.
It is okay. The way I look at it, it is the same circle of job career.
Exactly.
It is a good work experience for you,
exactly.
Somebody who's studying that type of professional career.
Exactly.
That makes sense. Thank you very much. So moving forward now, I would like to ask you, what does your typical day look like for you in the emergency room? And how do you balance the fast-paced environment with making a critical decision? And what kind of cases do you encounter most of the time?
See, the emergency department, which we also know as A&E, accident and emergency. In some areas, like in the States, they call it the ER, emergency room. And some other countries would say casualty department. So it's all the same thing. And as the name sounds from the nomenclature, you will appreciate that it's time critical decisions that we have to make. Everything has to be, you have to be on point. And so to be able to do that, you should know your stuff. From my own perspective, it's become easier because of experience. I've done this for years. So the experience factor comes in. A case comes in, you already know. You have to be spot on, with your diagnosis, because everything has to be critically done. If you miss, for example, somebody coming with a heart attack, if you miss that, it jeopardizes the whole care and can affect the person's life. So the decisions we'll make save lives or can save limb. For example, somebody comes in with a ischemic limb. If you don't
I don't know what that is.
well, ischemic limb means that a person is coming with a leg either dying or dead.
All right, yeah.
So if you don't
Broken
act
leg.
immediately, then you may need to cut the leg off.
All right.
So you want to save the limb.
All right.
And to save the limb, you need to identify, that's not right. Come on, let's get into action. Sometimes it could be from a trauma, so they've had an accident, the leg is crushed, and then it's bent, and then the blood supply is cut off. So very simple intervention that we do in the emergency department will improve the blood supply straight away, and the limb comes back to life. But if everything is time critical. So if you don't act immediately, you might end up losing that limb. So these are the things, we try to do to save lives. So people come in, they have cardiac arrest, for example. Cardiac arrest pretty much means that person is dead, right?
Yeah.
So
cardiac arrest, how does that attack?
So a heart attack is just that you have a blockage in your heart, and the heart is under serious stress. So if you give some medications quickly, it helps to temporarily unblock those blocked areas and improve circulation. But then that is just a temporary measure. The definite action needs to be taken in a correct facility. But the emergency department, a lot of the things we do are kind of temporarily quick life-saving either procedures or treatment. Those things we have to act in time. So someone comes in cardiac arrest, if it's proven that because what happens when a person dies, the oxygen supply to the brain is cut off. Now, if the oxygen supply is cut off for a certain amount of time, then there will be irreversible damage to the brain. So it doesn't matter what you do. If you get the person back to life, the brain may never come back to life. Every other thing might be working, but the brain is gone. So if someone gets into a cardiac arrest in time, a lot of times if we catch them on time, we start a resuscitation and we bring them back, and then they are intubated and assisted, and with time the body recovers, they wake up and they continue the journey of life.
That's amazing, man.
Yeah, it's just really catching things early, act immediately, correctly as well, and then allow the body to do the rest. As we continue to assist from our own end. Yeah.
Oh my God. Wow. That requires some intelligence there.
Yeah.
Oh man, that is amazing what you guys do, man, in emergency. So, have you used one of those ambulances?
Well, it depends. So all the patients are brought in to us. With an ambulance. Those that are very critical, they're usually brought in by ambulance. Now, do we need doctors to go into ambulance? Yes, in some cases when you want to transfer a very sick patient to another center, we do, depending on how critical they are, sometimes they need a doctor in the ambulance if they're very unstable. They will need to escort the patient to the next tertiary center. But normally, if you call an ambulance and they come to the house, you usually don't have a doctor there. The best you could have is a advanced paramedic. And they're very, very good.
They're doing a great job as well.
Oh yes, the paramedics are very vital in our society, in the medical society. In fact, when it comes to medicine, especially in the emergency department, we have different types of teams, and our team integration starts from the paramedic. So it starts with a paramedic team, and then you come in, you have the doctors, the nurses, you have the porters, the care assistants, and you have the technicians, you have the radiology team as well. And we all work together to for the interest of the patient, because we don't know it all. So sometimes we do what we need to do, and then the other teams, for example, the surgical team takes it from there, or the medical team takes it from there, or the cardiology team, the stroke team, after initial management, then a definite team takes it, would take it from there, depending on the extent of the case presentation. So if somebody comes into cardiac arrest, obviously we're not going to discharge them home when they wake up.
No.
So they need to be in the hospital for further management and rehabilitation and so on.
Okay.
So it's just teamwork, really.
Yeah. Teamwork is very vital.
Exactly.
In this part of,
and it's the communication amongst the teams as well that is vital. So because there is, to make communication very easy, you need a team leader. A team leader is the one that dishes out the instructions and other teams follow.
Okay.
So we always like to make it, if it's in the emergency department, the emergency doctor takes the lead in all this management and coordination with other teams, because this is something we see every single day. So it's kind of easier that way, and others now tend to follow, because if you're talking, I'm talking, the other person is talking, and we're all three giving instructions, then eventually, we come out with nothing.
True.
And that's the problem. Yeah. So, sometimes we need to focus on having a good communication, system. Yeah. That works.
Yeah, sure. Well, I have no clue what it is, but all I know that it's amazing and beautiful work you guys are doing there, man. Thank you so much. So, is there any impact of technology? And if there's so, how has technology changed the way emergency medicine is practiced? And are there any advancement or tools in the emergency medicine that have made a huge difference?
Yeah, I mean, technology in every aspect of life is so welcomed, and it's still an evolving thing. In fact, you now have the AI coming in as well.
AI is my best friend now.
Yeah.
After Google.
Yeah, so God knows what's going to happen in the future, probably.
I think AI will go far.
Yeah. So
They'll stay around for a while.
they may not need me in the hospital. They might just need the AI version of me, and that's it.
I don't think so.
But you see, when it comes to managing humans, because you're dealing with human life, you cannot leave it to the hands of computer or technology. You still need humans to be there to run the show. And yes, we do have some technology advancement in the emergency department, which is great, which is welcomed. For example, in doing our CPR in resuscitation, we have things like a Lucas device. So you just plug in the device and it just does the CPR and does it effectively. And you have to also, as humans, supervise to make sure that it's well programmed to do it with the duration, the depth, the effective compressions, and effectiveness of the compressions are also monitored. So, it is great, So, then you have some of our device, like the defibrillator device. Previously you would have been shocking things, but you're not even sure what you're shocking. Now, before you apply the shock, you do get the reading strip there in front of you. So you say, okay, so that's the correct thing to shock. Come and shock. Or we don't need to shock. We just keep going. Or based on that reading, we just give adrenaline.
From the technology, right?
Yeah. So these are some of our devices that we use in the resuscitation room. I mean, even technology goes wide. Improved breathing. You have your CPAP. You have your BiPAP machines. And they're getting more advanced, So all the setbacks and challenges we had with the old system, it's just been improved, upgraded. And then you're getting new devices coming in just to make things even easier, and also help to make sure that humans don't spend too much time trying to crack out and think out with just those devices also guiding you, it makes it a bit more easier. Radiological speaking, patients come in with trauma, we send them for scans. The scans are getting more better and much better, and picture quality is even improved a lot, so you can see more today than you could see before. And I tell you, in the next 10 years, it's even going to get much, much better, that you can see more, far more than you can see today. So
you guys see a lot now.
Yeah, we do see a lot. And the thing there is some of those deficiencies in terms of technology, clinically, we try to fill in the gap, so that we kind of also use our clinical acumen to make those calls that technology will also make for us. So that, there is no stone is left unturned. So yes, we do a lot. Technology helps us and guides us, and we do appreciate that. And that's the goodness of our practice.
Lovely. Beautiful. Interesting. I just imagine, what they can find inside me, that will come for, I don't know, scan. They call it X-ray or radiographer.
The X-ray, the CT scan.
Yeah, CT scan.
Yeah, and the MRI scan. And you also have your ultrasound scan.
And ultrasound. They are all part of a radiographer, yeah?
Yeah, they're all radiography.
Yeah. Beautiful.
Oh. Radiology.
Radiology. It is interesting to hear how does the area of job career in hospital. I've been in hospital a couple of times, but I don't know the difference with the departments. I know they're just pushing me around, going to where they have me treated.
You see, that's why, it's all teamwork, because there are over 20, 30 departments.
Yeah, it's huge. Yes, I've been looking at
easily,
the names, name of the wards, even like, jeez.
Yeah, even you have a security department, which again is very important. You have the domestics. Fantastic department. You need domestic department, especially during the COVID time. They played a wonderful role in making sure that the spread of COVID was well limited. The domestics were very vital there. That, and then you have the kitchen services, the hotel services. Now. Yeah. There's so many parts of the hospital that you never see and you never appreciate. But the role they play is massive, in terms of patient care, which is really amazing.
Cool. So moving on, how do you cope with the stress or burnout from working in such a high pressure environment? Do you have any strategy for staying calm during particularly chaotic shifts?
See, it's a difficult one. The thing people will advise is don't work too hard, especially when you're in the emergency department because of burnout. It's a very demanding department, and you're afraid of burning out. Yeah, it's always busy. It's non-stop. There is always high demands from the patients, from your colleagues. The demand is always there. So it kind of puts you under a lot of pressure. But the whole thing there is do not feel stressed. Just take it easy, one at a time. I mean, life is
too short.
You're not going to fix the problems of the world in one day.
No.
So,
true.
What are you stressing about? Just take it one step at a time.
That's great.
Try and see your patients. Remember to take your breaks. Take your breaks.
Yes.
And take it all easy. And when you're home, have a rest. Sleep well, eat well. I love football, so I always watch my team. So I use that as a relaxation avenue for myself. So I don't miss that. So
I know.
Yeah.
So sometimes, when men have appointment or are you late or you don't show up.
Because
I know
because my team is
there's match.
Yeah,
I
have
go check.
to watch.
Is that son on tonight?
Yeah.
And if I see that, I say, okay, my man.
So
Nice.
I do always entertain myself and take things
That's
easy,
beautiful. Yes, you deserve it.
Try to not to stress too much. I mean, there are cases that come in that could be very emotional as well. You try to make sure that doesn't take over you. You try to stay still, and well, this is usually the case. You can only make it better. Yeah. But you cannot make it worse. You can only make it better. So don't feel pressured. Don't feel guilty. Just do your job. Do your job, and that's all it is. And you will always feel good at the end of the day.
You can say that now based on the experience you have in the past years,
That's what I was going to say. It's easier for me to say because I have tried it different ways, and this is the only way that works.
Well, it's good also, to encourage the new guys, know about those things, how to relax, take it easy, one step at a time. That's beautiful. Yeah, stress is not good.
No need to stress.
All right, cool. So that will also lead us to, do you have any advice, inspiration? Like, what advice would you give to someone who's interested in pursuing emergency medicine? And what quality do you think makes someone successful in this field?
Okay. If you are interested in doing emergency medicine, it's important to have a passion for it. Because there's no need doing that because you feel there's more money there. No. If you're doing it for the money, you're in the wrong place. There has to be passion for it.
Yes.
If you're doing it because it's the easiest to be done, no, you're wrong.
Okay.
Firstly, have a passion in it, be intrigued by saving life, be intrigued by resuscitation, be intrigued by being a first responder. That is one of the core qualities there. So I want to be the person to come in to do that emergency procedure that will make this guy better or make this lady survive, and have a passion for what you do. Love what you do. Yes. So that is first. If you're still not sure whether or not you have a passion for it, you could do some rotation in the emergency department so you can see firsthand what it's all about. It is a very good avenue to learn as well because basically you're seeing patients coming in, you have no clue what is wrong with them. You can only depend by what you see, what you hear, what you feel, and based on their own story, based on your clinical findings, based on your investigations, you could make a decision. But it's just that challenge of not having any clue. And then at the end, walking around to get to the end of it all. That is the intriguing part of it. And you should be somebody that loves to be more systematic in approach to medical challenges, So don't rush into it. Think about it. Make sure you've had that experience by working there, doing some kind of elective there, before you make that decision. And you should be a very patient person. You should be able to act on the stressful atmosphere. Not necessarily that you will be stressed with the stressful atmosphere, but you should just be able to act and make the correct decisions irrespective of the stressors around you.
Cool. We have just 3 questions now left, then we let you be. So I will move on now to ask you about the future of emergency medicine. Where do you see the future of emergency medicine heading?
Well, I mean, it's difficult to say because, with medicine, you can never predict. Who could have predicted that COVID would have hit some years back. Nobody could. Because you're making your plans, your sessions, the feature deployments based on what you know now, but then something could strike, and then that derails all your plans and aspirations, especially for the department. So emergency medicine, as it stands now, based on what is happening now, there will be a high yield, high demand for more technology to assist in getting the job done. And I think there will be a lot of technological advancement in the way patients are being triaged in the emergency system and the way patients are being managed. You know, when you come into the emergency, you usually are seen by a nurse first who does the triaging and gives the different category for patients. So if you're very severe, you're category 1. The category 2s are severe. Category 3s are serious ones. Category 4, not too life-threatening, so it's fine. Category 5 means
more categories.
It's pretty much what are you even doing here? So these are different categories. But you never say that to patients, because you have to make sure that all the patients that come into the hospital, you have to appreciate that they have come in because something genuinely is bothering them. And you put them in those categories, and then you attend to them based on that, on the different categories there. Maybe with time, technology will also be deployed there to help facilitate these categorization to make sure that it's 100% correct, so that somebody that is supposed to be in category 2 doesn't end up in category 4 because they are not able to communicate with you correctly what their problems are. And then, you know, because basically your categorization is based on what they're telling you and what you see. You know, they could tell you that, you know, I feel fine. And a lot of people do that, you know, I feel fine, but the family is forcing me to come in, you know. So when you finish the whole analysis, you're like, oh, maybe they need to be in a category 3, but indeed they need to be in category 2. You know, so it sometimes could be very difficult, but this nurses in triage, they're amazing. They do a wonderful job. They get it right most of the time, you know. Based on the Manchester triage system which they use.
That's based on the human decision.
Yeah, you know, the analysis is based on it's a paper analysis based on human factor. But you know, with technology deployment there could be some AI assistance that will help facilitate, you know, this categorization and make it even 100% more effective and accurate, you know. We could see that happening. We could also see a better technology being deployed in the resuscitation area, whereby most of the things that we do can also be guided by robotics. You see that in surgery. They've gone in a long way in using robots in doing surgery.
Interesting.
So it does happen. That could be the future for us in the emergency department. But again, you need humans there at all times to manage whatever technology you bring in.
True. I understand that.
So and we're going paperless slowly. You know, with time, we're gonna end up being paperless department. So everything is just more on the computers.
AI. AI world. But trust me, they're still gonna be, like you said before, you know, they're gonna still be a human being there, you know, to manage those AI technologies.
Exactly.
to keep them on check.
Yeah.
They want to keep us in check. But no, I don't want that.
Because it's a human that has drafted those programs.
Of course, yeah.
Yeah, so
we will. That's why I think it works.
We have to keep them in
generation,
check.
Yeah, the generation need to know.
Not vice versa. You know.
Yeah, generation need to know. Yeah, it's a human being that program AI.
Yeah.
So there's still gonna be a human being there to monitor them and make sure they're doing their work.
It's just sometimes I ring some officers and I'm trying to get this done, that done. They said, "Oh, the system won't allow me."
Yeah.
I'm like, okay, this is an emergency. Yeah, but the system won't allow me.
Yeah.
I'm like, okay, are we slaves to the system or what?
AI system.
You know,
that's where they operate. Yeah. We're gonna go to the final question here to round up the interview. I'm gonna go on now and ask you the most rewarding part of your job. Is there anything you do like people to have better understanding about emergency medicine?
Yeah. So one thing any doctor would tell you is if they treat a patient and the patient is fine, there is a lot of joy that brings, to them.
That is good. Yeah.
Yeah. So
when you do a good job,
exactly. And every day I go to work, I'm always going to help. I want to make sure that anybody that comes my way gets better. And that is the rewarding part of my job, that going home, I've seen this amount of patients, I impacted positively in their lives, and they've come in with this problem, that problem, and they've gone home feeling much, much better. That is always rewarding. And sometimes, because I remember a time when I had a very challenging case, you had those 14-year-olds, 15-year-olds. When you're dealing with traumatic cardiac arrest, that's when young people are involved in accidents and then they come in almost lifeless. It is very, very emotional. It's challenging. But when you do the resuscitation and then at the end they all come out, they survive it. And then you see them 10 years later, trying to... Yeah, they're looking, you say, oh, thank God, thank God that you were there. You were part of the team that helped bring these guys back to life, to save their life. You're part of the team that saved their life. It's great. It's a great feeling.
Yeah, it is.
So when you go home, you've helped. And then years back, you see the people that you've helped being appreciative as well. They come your way, you meet them, outside, they come back for checkup, things like that, and they so much gratitude. It is very rewarding, and I like that. And sometimes you see people in great distress, for example. Somebody comes in with an pneumothorax. That means that the lung is collapsed. They come in with so much pain, they're holding their chest. And then you stick a tube in, poof, and they're smiling again. That simple thing, it's so rewarding. Like,
it's beautiful.
It's
a beautiful thing. Yes.
Yeah. And you don't really see it as anything, but forever the person is grateful to you. You see somebody that said, "Oh, for the last 15 hours, I cannot pee. I've tried to pee. I've done everything. I cannot pee." You see them, they're screaming in pain. You stick a tube in, drain the urine, and they all smile.
Again.
You're just like, whoa. There are many, many stories there, many, many stories. And so kind of rewarded. I mean, sometimes you could hear some bad stories when, somebody comes in with one problem, you investigate, you find out that, it's not just this one problem, it's a bigger problem, and then in your mind, you're like, oh God, I've seen this happen before. It didn't end well. But, you have to be positive. You have to be positive because you need the patients to be positive as well, and be honest with them in every way possible. So say honesty. Honesty means don't lie to them. But if telling them the whole truth, it's going to have a negative effect to their recovery. You may not lie, but don't say it all. Say what they need to know at that given time, and then periodically you can elaborate. But there is a technique to this, but never lie to the patients. Never. Always be honest with them. Always be honest.
If the lie is gonna
also in your honesty, know what you're saying, so that you don't have a negative effect to their recovery. And
even if the lie gonna make them happy, don't just be honest.
Exactly. So you just moderate things.
Stay honest.
But the most important thing is always be honest with your patients and with your colleagues. Because it makes everything easier. It just means that when you're managing, you know what you're managing. And what when they're dealing with things, they know what they're dealing with.
Yes.
So that's the main story there. But I enjoy this job and I love it. I enjoy it. It's a very rewarding one for me as well in terms of outcomes. I like it.
Thank you. That's great, man. We are so proud of you, Dr. Chike. We are so much happy for what you do for the society and for the world. Thank you so much. I think you have given us almost everything that we wanted. So we are very
and even to the young people out there, the whole thing there is, if you see what you enjoy that could impact on people positively, go ahead and pursue your dreams. Don't look back. Sometimes you say you want to do this, but you don't think you can get there because of a lot of challenges and shortcomings from where you're coming from or from your family. It doesn't work that way. If this is your dream and you feel that you can achieve it, go for it. Put in all your energy there. Put your energy there. And avoid distractions, because that's the problem why people never reach where they hope to be.
Distraction.
Distraction. Just avoid all the distractions, focus, and put in all your best with a very good positive attitude. You will always get there. And we need more doctors from our community. We need more youth to engage in positive minds. Come out to good doers and showcase what they have, and even to see how they can be promoted, because there are a lot of good doers out there that will help promote our youth and shape them to be better people in the society. And that's what we want. We don't want, be hearing about cultism amongst our youth, or gang amongst our youth, or prison. We don't want to be hearing that. What we want to be hearing is that the best graduated medical student is from our community. The best graduating pharmacist from our community. This is what we want to hear.
That's great.
And we can make it happen. And that's why platforms like this should be well appreciated, because through networks of this nature, we can also let other people see what other good doers have achieved, and then know that it can be done.
Yes, I believe.
So it's a great one, and I must encourage you and your team to continue with the good work.
Thank you very much.
To displaying
get everyone together,
our talents,
get everyone
out there,
to move their butts.
We do appreciate.
Trying to get their hands in doctor careers, because it is a rewarding, man. When you save lives, it is a rewarding. It is amazing when you help someone. So be inspired by his journey and learn how each of us can play a role in our community and the world. Thank you very much for coming here, Dr. Chike. Like I said, it is
Thank you very
honor.
much. Yeah.
It is very honored to have you on the show, man.
Thank you.
You are part of the show. How do you do it over there? Yeah, tribal handshake.
Oh, yeah. 1, 2, 3. And then
normal way. Yeah, that is amazing. Wow, that seems like a beautiful culture. Yeah, where we'll like to touch more about your autobiography, in our next episode.
That's fine.
So we're very, very happy to have you, open up the show for us.
Thank you.
Today.
And I feel very honored and privileged.
I know you could be anywhere in the world now, because it is a very busy moment of the year here in Ireland and all over the world. But you decided to be here in our show to support us. It is our pleasure and honor to have you, Dr. Chike, once again. Thank you very much. We have gotten everything we needed from you. And I said we'll round up the show here. Is there anything else you would like to let the youth know, let the world know?
Very important, because we're seeing this a lot in the emergency department. Stay away from drugs. Regulate your drinks.
Drug is bad for you.
The age is getting younger, and it's
drink moderate.
It's painful as a parent, seeing your young ones coming to the emergency department under the influence of recreational drugs. A lot of times they could die from it. Some other times they have some irreversible injuries from it. And then sometimes you see them coming drunk. Again, that is not what we hope for our youths. We do want our youths to abstain from all these distractions and focus on their purpose.
Yes.
So
what is the purpose?
The purpose is to have some kind of accomplishment in life.
Why we're alive, yes.
Yeah.
The purpose why we're alive.
If you
focus
go to school,
on the purpose why we're alive.
If you go to school, finish your studies. It's very important.
Yeah.
Don't say my father didn't study this, so I'm not gonna. No, I'm not saying that education is the key to everything. I'm only saying that education, it should be a basic requirement in every individual's life growing up. It should be a basic requirement.
It's a step away.
So after you finish your studies, it broadens your horizon to now know that there are other aspects of life, and then you can now see which of this aspect of life do I now go into. It kind of shapes you in a very decent place, and also it kind of makes you have a purpose. And that's why you see people roaming about without any purpose, just because they missed that calling, which was given on a platter.
Yeah.
So I will advise them, please, don't look at people that have made it because they haven't attended any school and they are making it and say that you could also be there. No, it's just because if you don't have that basic requirement, even if you make it, can you sustain it? And that's the question. Can you sustain it at that level and even continue to rise?
Sustain it.
Can you sustain it?
Stay there. Okay.
One thing you don't want in life is going up and coming down.
They said you washed up. Okay, this is the one I hear now.
Exactly.
You washed up.
Yeah.
So if you're doing something, be good at it.
Yeah.
And keep elevating yourself.
Exactly. Yeah. And stay away from having stains in your life. See people go to jail and come out. That is a stain that will always be there. Avoid
stay away from in and
all
out
that.
of prison. There's nothing good coming out of that.
Exactly. I really think that our youths are very lucky because they have everything they need. Us growing up, we didn't have everything.
Here in Ireland, you mean, yeah?
Yeah, in Ireland.
Yeah.
They have everything they need.
Too.
When we were growing up, we didn't have everything we needed.
No.
There were always things that were missing.
I don't have anything.
Yeah.
Not everything. I don't have anything.
And every time there was something or things that are missing, you know. And so God knows what we could have been if we had a complete childhood, you know.
Yeah, it would be amazing, man.
Yeah.
It would be amazing. But otherwise, time, you know, like.
Exactly.
Yeah,
so, but even with all that, we still became somebody. A lot of people from being nobody became somebody.
True, yeah.
So you cannot now become already born a somebody. And you end up being a nobody. It doesn't make sense.
No, it doesn't.
You know,
it doesn't make sense to me too.
Because all the youths here, they've been born now. They are somebody.
Yes, this is a great country.
Yeah,
their system is working somehow.
Everything is there.
Yeah,
everything. You have everything at your beck and call. So there is no excuse.
No excuse.
You know, there is no excuse for anyone to be doing drugs. There's no excuse to be a drunk.
Yeah.
You know,
all your life.
There's no excuse to waste your life.
No.
There's no excuse.
I get that from you. So I'll moderate my alcohol now because I used to be alcohol lover, but since you said it now, I have to cut it down.
Moderation, regulation.
Okay.
But there are just things, anything that impacts your life, that affects your ability to control yourself, control your reasoning, control your being, just avoid it.
True.
You should be in full control of yourself at every given time.
True.
You know, so if a drug will influence you, stay away from it. If alcohol will change your perception or your ability to have correct judgment, stay away from it. It's just very simple.
We stay away. You have given us what we need, you know, and I hope that inspires youths, you know. I think the youth really need this type of inspiration.
Wanna see hot, wanna see hot, wanna see loving, wanna see hot, wanna see love, wanna see what, wanna see loving. Wanna see you loving, baby. Wanna see you walking with me first, French love. And they try to speak my French up. We are new. And they try to speak my French up. Wanna see rock, wanna see hot, wanna see hot, wanna see loving, wanna see hot, wanna see love, wanna see what, wanna see loving. Yeah.